Welcome to the Gary Null Show, a program designed to enhance mental, physical, and spiritual well-being through science and the wisdom of the ages. Let us take you on a journey of empowerment. Sit back, relax, and get ready to change your life for good.
Dr. Martin Feldman is Assistant Clinic Professor of Neurology at Mount Sinai Medical School in New York City. He is a board-certified neurologist, considered one of the leading holistic neurologists in America. He's published over 65 papers in peer-reviewed journals.
Thank you, Gary. There's an epidemic in America of hypoglycemia, not only diabetes, but also hypoglycemia, meaning glucose is low, hypo, low, glycemia, glucose. The problem is that it's episodic. The body has a thermostat which controls the glucose minute by minute, and the glucose has to be maintained at a certain level. If the glucose level falls too much or goes down rapidly, the brain is affected because the major fuel of the brain is glucose. That glucose level can cause episodic symptoms, meaning you get a symptom, it comes for a while. Many people learn if they eat a little bit, the symptom goes away, or they may in time just see the symptom abates and occurs again and again. The episodic is the key word because it comes and it goes. And therefore, most physicians will not be able to test it properly. Glucose levels are an important issue, but the glucose level usually is just of one moment. When the needle goes into the arm and gets out some blood, the glucose is taken at that moment. But that moment, the glucose is commonly okay. So the patient has to understand they have to diagnose themselves partially. And how do they do that? Well, they commonly will learn to carry around food or to, when they feel badly enough, go and eat something. They tend to crave carbohydrate. But the key is the symptom also tends to be brain-related, such as episodic headache, dizziness that's episodic, brain fog that's episodic, concentration falters. Also, the need to have caffeine commonly is part of that. For example, the British, they've learned to have tea time. Tea time is usually about 3 o'clock, 3:30. They eat lunch maybe 1 o'clock, so 2-3 hours later, glucose may be down. They take tea, which has caffeine, brings the glucose back up. They've solved the problem for that moment. Many people also have been told that, well, the thing to do for hypoglycemia is to take frequent small meals with protein. That does help a great deal, but it doesn't fix the problem, and this is the problem. There's an internal thermostat, and it is composed of the following. The pancreas, we've all heard about insulin. Pancreas is key. Pancreas has insulin and glucagon. The adrenals have glucocorticoids, which tend to harmonize glucose levels, and the liver has glycogen. We have to go back and rebalance the thermostat. Pancreas tends to like the following nutrients very, very, very much. Chromium. You may have to have a higher dose. 200 micrograms is a beginning dose. You may have to go double that, even triple that. Chromium, picolinate, or other types of chromium are very effective. They're inexpensive. They're very safe to take. They do the job very, very well. Next is zinc. Zinc is a simple mineral, inexpensive. Again, there are many forms of zinc. There's a chelate, there's picolinate, there's many forms of good zinc. You may have to start at 20 milligrams, you may have to go to 40 or even 60. Next would be manganese, not magnesium, but manganese commonly does help. 10 milligrams or even more to help the pancreas to rebalance. B-complex, 50 milligrams per tablet or more, 3 or 4 times a day.
Our next panelist is Dr. Chris Kortman. He is a licensed psychologist. He's been practicing more than 23 years. He has spent over 50,000 hours in counseling. That's an awful lot of hours. Nice to have you with us today, Dr. Kortman.
Thank you, Gary. It's nice to be here. You know, you ask a question, how did we get here in the first place as a society? How is this generation so overweight? And why is there so much of an issue with type 2 diabetes? Why is it that this is the first generation that might not outlive its parents? Well, there's some things we have to take into consideration. First of all, the average child is watching more than 30 hours of television per week. So who is the storyteller in our society? It's the media. And what kind of story is the media telling us? Well, for one thing, we learn that we need to have things and we need to have them fast. And they need to be easy. And they need to be short-term gratifying. And when we think about who's doing the advertising, the food is fast food. And the food is instantaneously gratifying. And you can get it in a second. You just drive through the drive-through window and you pick it up and your kids are fed in a matter of minutes. And in today's fast-paced, high-stress world, that's easy. That works. It's difficult to put together a meal that is well-balanced for a lot of parents. It's so much easier to just grab something at a fast food restaurant. What leads people to change? How do we get to a place where we want to change? I'm listening to the doctors on the panel here say that we need to nip this very early on, early detection. Let's prevent it. But there's a problem with that. And the problem is, psychologically speaking, people don't do anything until it's too late or very late in the game. I was taught in graduate school, people don't change unless it's too painful not to. I've done more than 50,000 hours of psychotherapy, and I'm still waiting for my first patient to come in and say, I want to talk about improving my life. Nobody does that. People come in because they're in crisis. They have trauma. When they come in, they're already several hundred pounds overweight with diabetes. Now let's talk about what tends to sabotage change. Who and what is the saboteur? I believe that we all have a saboteur inside. Now, why would we create a part of us to stop us from improving our lifestyle? Well, there's an answer to that. And the answer is all about fear. Sometimes it's very scary to change things. Well, what would be so scary about changing my diet? Well, I've had more than one person tell me that food is not only the comfort in their life, it's their best friend. For one woman, she said the two best friends in her life are Ben and Jerry. Those are the guys that she counts on when she's feeling lonely. And that's who she turns to when she's sad. For her to give this up is like giving up a best friend. That's who she goes to when times are difficult. But there are other reasons. If I decide that I want to change my lifestyle, I have to get off the couch. That's pretty difficult if I'm weighing 300 pounds. To start a daily exercise regimen when I'm weighing that much, and then I have to put it into my life somewhere. Where do I put it? I mean, I'm working full time. I've got children. I'm trying to do the best I can to make ends meet. Where and how am I going to add this exercise in? And again, it's so much easier to do what? That which I've always been doing. Human beings are creatures of habit. If you want to know what someone's going to do next Tuesday night, follow them around for several Tuesday nights. You'll have a pretty good clue what they're going to do for the next Tuesday night. And in order for us to change these kinds of behaviors, we not only need to have a different mindset, we have to have a plan. And the plan has to be something that's built into the schedule. I'll tell my patients that after my day of work today, I'm going to lift weights. It is not contingent upon how I feel. It does not matter what's going on in my life. I'm going to lift weights, and you know why? Because it's not an option. It's mandatory. If I want to be where I want to be in life, that's going to happen tonight. And in order to have that kind of a mindset, people need a plan. If I'm going to eat right, I need to have a plan. And the plan has to take into account something that I'm going to do every day of the week. I got to know what I'm going to eat for breakfast, what I'm going to eat for lunch, and what I'm going to eat for dinner. And it has to be already not only a mindset, but something that's laid aside, something that's already there. It can't come down to how I feel, and it can't come down to random decisions at the time, because I will sabotage it, again, in favor of what's fast and what's easy and what's immediately gratifying. So what kind of a mindset do I need? I need to, first of all, believe that this is a possibility. And I need to believe that there's a plan that's going to help me. And I need to have a sober perspective that says, I got to do this one day at a time. I did not gain 200 pounds overnight, and I'm not going to lose them overnight. There's not an instant or quick fix. I want to be focused on one day at a time, doing everything I need to do today, do it right today, and tomorrow when I wake up, I need to do it right again tomorrow. That's how I'm going to get there eventually. And I'm going to slip, and I'm going to fall back, and when I do, I build that into the equation, and I remind myself that I have to get up again and stay with the program one day at a time.
Dr. Harold Shininsky is one of the leading voices of reason in the state of Florida. In fact, he was recently the top psychologist in the state of Florida, voted by his peers.
Thank you, Gary. Why do we make poor choices? How do we get to the place that we're at? It's not just some type of a surprise that happens out of night. It's a long series of permission-granting acts that you've allowed yourself to get to the position that we're oftentimes in. The majority of people that we're talking about have type 2 diabetes. We've worked our way into this situation. Our society is based off of fast food. The reality is that we are eating ourselves into this situation. Our sedentary lifestyles have led to this. It's a number of factors that contribute to it. And clearly, we want to be proactive about it. So why do people end up giving themselves permission to do these types of behaviors? You have to look at it in terms of we're the best and the worst of what we're exposed to. Our own background, the childhood experiences we have, what we're taught. We used to have families that would bring their infants into our waiting room, and they would be feeding them French fries as their meal. We had children who weren't engaging in any behaviors besides playing video games. You lead a sedentary lifestyle, your brain shuts down, your body shuts down, there's no level of motivation. So we want to be able to address what are these issues. Well, we kind of talk about it with permission, denial. There are 16 forms of denial, but I don't have to go all of them. But we heard some, giving yourself permission. Well, what happens there? You justify your behavior. You give yourself rationalizations, excuses, alibis for why you deserve this. Each one of these opportunities that you talk yourself into leads to an unhealthy cycle. These cycles are oftentimes referred to as compulsive behaviors. When we look at these compulsive behaviors, what we end up seeing is an individual who is probably trying to do their best, get through life, and then some stressor takes place, some emotional strain. We have individuals who have some type of perceived stress in their life, and that's what it is. It's a perception. To one individual, that same situation may not be stressful, but to this individual, it is stressful. So they have this emotional reaction that causes them to have a thought, and the thought is, what do I do? A coping skill. Now that's where we come into it, through counseling, therapy, working with all the providers up here. We can learn new ways to deal with these difficult situations. We want to be able to figure out, when is someone at a point of change? And there's a model called the Stages of Change model. It has 5 steps. Let me walk you through it and take a look at where you're at or where your loved one's at. The first stage in the stages of change is pre-contemplative. That means either I'm not thinking about it, I may be ignorant to it, unaware. The doctor might say, listen, you're morbidly obese, you eat poorly, you don't exercise, you have a family history of this condition, you might want to consider changing this. And that person might say, gosh, I didn't know that. Pre-contemplative, unknown. It could also be, no, I'm going to do whatever I want. It's the democratic disease model. I can do whatever I want to my body, and you're not going to tell me anything about it. Hyper-resistant individual, pre-contemplative. People can only move one stage at a time. We know that from the research, we can jam people in the best practice models of interventions. Those individuals who fail are struggling because they're not at a point of being ready. So they go from pre-contemplative to a contemplative phase, where they're thinking about what's best for them. They're weighing it out, the pros and cons. They're being able to figure out what is the best outcome for them, what's the worst, if they take action, if they don't take action. And once you work through weighing out the scale, you come to the point where you've made a decision. I need to do something different. And I'm saying that's why you're all watching right now. You get to the preparation phase. And the preparation phase is you get your ducks in a row. You make sure that you have friends and family that support you. You clean out the refrigerator, the bad foods. You make sure you do all the healthy things you're supposed to. But you haven't changed yet. All the people who fail in treatment, when we assess them in terms of stages of change and readiness, 40% of them are pre-contemplative, 40% are in contemplative, and 20% are in the preparation phase, because they haven't been moved to the point of action. Once you're in the action phase, and each one of you out there are at this point where you're thinking, I got to do something different. My loved one needs to do something different. At this point, you're doing all the behaviors, but yet people relapse. And we know that. Change is difficult. So finally, after a couple of months of doing the right thing, we get into the maintenance phase. And the maintenance phase is where it becomes part of a lifestyle. What we're talking about is our society. We have a systemic problem. We have contributed to our own problems. and we have to take a proactive stance. We can't passively wait for people to do things for us. You and your loved ones, by watching the show, clearly are taking that stance. And I hope that you take all the information that we're sharing with you today and apply it to your life.
Doctors Patricia Gerbarg and Dr. Richard Brown are husband and wife. She is Assistant Clinical Professor of Psychiatry at New York Medical College. He is Associate Clinical Professor of Psychiatry at Columbia University. Nice to have you with us.
Thank you, Gary. We're delighted to be here. We know that when people are under stress, basically they're feeling anxious, worried, frightened. Often they're feeling overwhelmed, they're feeling alone, they don't know what to do. And you could just sum it up in one word: they feel unsafe. Now, we have to understand that everything in our body is balanced. There's a kind of yin and yang to everything. And that's true of the stress response system as well. And the two components that we're going to focus on are the sympathetic system and the parasympathetic system. The sympathetic system is that part of our nervous system that responds to threat or danger by getting us ready to either fight or run away, by increasing adrenaline release, increasing our heart rate, increasing our respiratory rate, and that's very necessary to survival. But the problem that we have in our culture is that system was designed for dealing with intermittent, short-acting threats. The saber-toothed tiger appears, our stress response goes into action, we either fight or run away. And then when the danger is past, our system can calm back down again. That's where the counterpoint comes in, the parasympathetic system, which does the opposite. In other words, the sympathetic system speeds up the heart, the parasympathetic system slows it down. So there's this constant balance which allows us to have fine-tuned responses. So when things go wrong with the stress response system, it has many consequences. And unfortunately what happens is that the sympathetic system becomes chronically overactivated. When the sympathetic system is overactivated, it inhibits insulin release, and it affects glucose metabolism, and it increases blood pressure, and it has many of the consequences that everyone's been talking about in terms of increasing many of those risk indices for cardiovascular disease, diabetes, and so forth. The other part of the problem, and this is something that's only been recognized, I'd say, maybe in the last 10 years, is that not only is the sympathetic system overactivated, the parasympathetic system is actually in an underactive state. The parasympathetic system not only counteracts the activity of the sympathetic system, but it has many far-reaching effects psychologically as well as physiologically. And there are certain nerves, particularly they're called the vagus nerves, that are the main pathways of the parasympathetic system. And these are two nerves that come out from the brainstem and wander down through the chest and then down through the abdominal cavity and send branches to all our internal organ systems and tissues of the body. The vagus nerve innervates the pancreas. And in fact, when you activate the vagus nerve, that is what will cause release of insulin. And the parasympathetic system and the vagus nerve are critical in terms of optimally managing the level of glucose. In terms of the sympathetic system, most of the medications that we use in psychiatry, the anxiety, anxiolytic medications, the antidepressants, they're pretty much designed to just kind of dampen down the sympathetic system temporarily. We actually don't have any medications that will strengthen or boost the parasympathetic system because it's been such a neglected area of research for decades. It turns out that there are certain activities that will boost the parasympathetic system, and they often are things that have to do with bonding, with love, with close relationships. So for example, cuddling with someone you love, sharing loving feelings, that will actually activate your parasympathetic system. But beyond that, there are certain mind-body practices that have been shown in many research studies to help balance the stress response system. And there are perhaps 70 studies of yoga practices, mind-body practices, showing that these mind-body practices can significantly reduce the risk factors in people with metabolic syndrome, insulin resistance, cardiovascular risk factors, and type 2 diabetes. Now, we're particularly interested in trying to find practices that will fit into modern life. These practices, it's hard for people to understand or believe, but they reach every deep nook and cranny of the psyche, as well as correcting physiological imbalances. And they can produce, in many people, a rapid improvement, even in long-standing chronic symptoms. So we're also using these in our practices. I've been in clinical practice for over 25 years, and instead of giving a prescription for, I won't name which, anxiolytic, I will teach people a certain breath practice which they can use to rapidly reduce anxiety and help them sleep if they're having insomnia, and deal with uncomfortable emotions, calm themselves down using this so that they can deal with stressful situations without having to run to the refrigerator or eat some comfort food or whatever unhealthy practices they have been doing. And when you voluntarily control and change the pattern and the rate of your breathing, you change the messages that are being sent from thousands of receptors in the lungs, the chest cavity, the pharynx, and the throat, all of which feed into the vagus nerve and the parasympathetic system. You're changing the messages your body is sending to your brain. And I call this interoceptive messaging. When you change those messages, your body is telling the brain, you know what? It really is safe. You really can relax now. And it goes right into the emotion centers and right into the thinking centers as well. The whole mind calms down very rapidly.
I'd like to just slightly expand the perspective on stress. Stress is a factor in most illnesses. What's stress? Stress is any change that's happening inside us or around us, and it is happening constantly. We're usually not aware of it because our stress response system is so effective. What we don't realize is our stress response system is turned on most of the time, even while we're asleep and dreaming. And we don't know how to turn it down and turn up the recharging system. And the stress response system, when it's turned on and goes on more than it's needed, which is most of the time, it creates a lot of inflammation and stress hormones, and it burns a lot of energy. So what do we often do is we put food in, a source of energy. Carbs are quick energy, fat is high quality energy, but food is only one of our sources of energy. We need good sleep, which a lot of people don't get in our society. We need the proper balance of rest and exercise. We need breathing. You can go 30 or 40 days without eating. We can go maybe 5 or 6 days without sleeping. You can only go a few minutes without breathing. And the breathing rate and the depth you do it regulates the balance of your stress response system to the parasympathetic system, which is your soothing, recharging, anti-inflammation system. And it turns out when energy in cells in the hypothalamus, a part of the brain, drop, that drives you to eat. And stress will cause you to burn more energy, and if you primarily rely on food as your source of energy, you will turn to that over and over as a habit. When your energy drops, your thoughts and feelings become more negative, and you become much more focused on the outside world. You're focused on what is going to make me feel good or bad, and often you're focused on superficial aspects. And you're not aware of the signals from your body of, do I really need this? Am I tending toward the food because of feeling lonely or emotionally empty or other stresses happening in my life and I need some comfort right now? And maybe there are other ways. And instead of reacting to the stress that way, we can respond thoughtfully. So the average person is breathing about 15 to 18 breaths per minute. It turns out when you breathe at about 5 or 6 breaths per minute, it changes this balance. Instead of your stress response system, which turns on easily and doesn't turn off easily, and your soothing, recharging system, which doesn't turn on easily without training and shuts off in an instant, you take them and you bring them up and you balance them if you learn how to slow the breath down. And it's a very easy thing to do as a recharge or to deal with stress, and it reduces people's cravings. Young babies breathe in a very relaxed way that balances these systems
we adults have to be retrained. So a simple way is to practice every day, breathing at about 5 or 6 breaths per minute. Now, there are more advanced ways of also making this breathing even better for recharging and soothing and healing our system. So instead of being like a gas-guzzling SUV, because if your stress system is turned on all the time, you're burning a lot more energy than you really need, and you have to continually refuel to feed it. But instead, if you learn how to recharge as you go, you're like a hybrid that's conserving energy while expending some energy. Because you need your stress response system to be appropriately turned on, the right amount, but balanced. That also means you're not only more in touch with your inner thoughts and feelings, but your brain can solve more complex problems in a novel way. And you keep your sense of humor all the way through. I'll give you one example. A woman was dragged to one of our movement, breathing, and meditation courses, combining yoga and qigong, and she was 300 pounds. She was terrified of coming. And there was no way she could even do a walking program or a bicycling program. At least it was never going to happen. So she came to the course. She looked very frightened. And by the end of a several-day course, what she said was, I'm so aware now of my body, and I really love my body again. I'd grown to hate it and to avoid thinking about it, and I used food as a distraction. And I didn't realize how I had this feeling of emptiness and loneliness and also wanting to stay separate from people because no one could like me the way I am. And she also became more aware of how thoughts would drive her eating, certain thoughts. She became much more aware not only of her body and the signals from her body telling her whether it was the right time to eat, but how much to eat and whether it was time to stop eating. And she really had a very different relationship with her mind, body, spirit complex, and felt empowered to continue the changes. And over a number of months, and every day she had some breathing, a little bit of movement, it didn't take much time, and some peaceful meditation and prayer, she gradually lost weight over time. She realized she wasn't eating as much. She didn't need to eat as much because she was much more content with what she was eating and very connected to the signals from her body. The process still continues for her, but the journey of 1,000 miles starts with a single step.
Hopefully, with each piece of the puzzle put together, how to de-stress and how to rebalance your body chemistry and how to make lifestyle choices, how to work with your family, how to give yourself no more excuses, no more procrastinating, how, as one of the good doctors said, why is it we have to wait until we're crashing and burning before we decide, gee whiz, I better change because I'm more fearful of dying than I am of the change I have to make? Why can't we simply say, I'm worth it. My life's worth it. My sense of well-being, my happiness is worth it. And when we just slow down and say, how would I ideally like to feel? And then that becomes a positive image that we put in our mind each day. So you see, when we put all these pieces together, it's not that difficult. I want to thank you for taking the time to watch this program. I'm Gary Null.